Here I am at age 9. This is the year I was diagnosed with type 1 diabetes. I felt confused. I felt a little scared, but I felt alone. And over the 4 decades of my life with diabetes to date, I've likely experienced all the emotions possible. Being diagnosed with diabetes had such a profound and immediate impact on me that while I was still in the hospital, I decided that my career would be in healthcare. I went from that 9-year-old to becoming a national president of the American Diabetes Association. For everyone, being diagnosed with diabetes triggers a human response. I'll use the word reaction to name common emotions that diabetes elicits. You may resent that diabetes has taken away your freedom to do things the old way, the way you used to do them. You might feel enraged, angry that you have a disease, or that your body now has to rely on medications to function properly. Sometimes people feel ashamed. They feel guilt or stigma that society places on diabetes, and especially type 2 diabetes. Often there may even be a personal sense of guilt, the question, am I responsible for this happening to me? Some people go cold, go numb emotionally, walling up to protect themselves against any rush of emotions. You may feel threatened by diabetes and its cardiovascular complications, that risk of heart disease. You might worry about the unknown and what it might mean for your future. Will I see the grandchildren grow up? Will I suffer a heart attack or a stroke? You may feel in distress, the sadness that comes with mourning loss of things that were a part of your life, or feeling the loss of freedom. You may feel the overwhelm and the stress of juggling diabetes and life, trying to keep up with all that diabetes demands every day, along with the demands of life, work, and family. And you might be nervous or unsure about your own ability to take on diabetes and do the routine care that it needs in order to prevent or reduce your risk of heart disease. These are all normal human responses. When people experience high levels of these emotions related to having diabetes, we actually have a word for that. It's called diabetes distress. And studies show that the vast majority of people with diabetes do experience diabetes distress at some point in the course of their lives with diabetes. Now, what do you do about these emotions? Healthy coping is a core component of diabetes self-management. It's recognized as just as important as monitoring your blood sugar, keeping your blood pressure under control, or watching what you eat. To exercise healthy coping, here are 6 things you can do. Number 1, be kind to yourself. Allow yourself the time to transition to living a new normal. Many people see diabetes as a challenge. They see it as something to take on, something to defeat, a new life goal. This is a take 2, an opportunity to start over and start anew. Number 2, find your safe space, your place to talk it out, cry it out, and vent the daily frustrations when you need to. Number 3, be careful not to tie your feelings of self-worth and your feelings of success or failure in life to your diabetes. Diabetes has a lot of data. Blood sugar numbers, your A1C levels, your blood pressure numbers, your weight targets, cholesterol numbers. There's constant evaluation going on. It's very easy to slip into feeling that you are the disease or the disease is your life. And sometimes healthcare providers slip into this too. The disease will have its ups and downs, but you are a full human being with many life goals and skills and priorities and talents and accomplishments. Keep in mind you are a person who's managing the disease. Number 4, let the people close to you know how they can support you. People around you want to be helpful, but they're going to do it in their own way. Let them know what does feel supportive and what doesn't feel supportive. Number 5, share your experience of diabetes with your healthcare team. They should check in with you at regular intervals on how you're coping, how you're dealing with the emotional side. And number 6, learn all that you can about how to manage diabetes and your risk for heart disease, and then set small, clear goals that are doable. With time, you can gain a sense of mastery over what you can do to manage the disease and start feeling less like diabetes is controlling you and more like you are taking charge of living your life with diabetes. Now, what about emotions that go beyond the ones that you can cope with on your own, beyond the ones that the support from your best friend or significant other can do to make a difference? When are the emotions telling you that it's time for a professional to intervene? Believe it or not, major depression is common in diabetes. 1 in every 4 people with diabetes experiences major depression at some point. It's associated with worse self-care and medication adherence and higher rates of diabetes complications. So here are some questions you can ask yourself to know if what you're experiencing might be major depression. Do you find yourself feeling sad most of the time or most days? Or not feeling pleasure the way you used to, crying more, feeling guilt or blame, eating more or not having an appetite at all, or sleeping more or having a difficult time sleeping? Does your mood interfere with your carrying on with your life, going to work, going to school, taking care of your children, doing your routines? These are all signals that professional help may be needed. Anxiety disorders are also common in diabetes. About 1 in every 5 people with diabetes experiences a generalized anxiety disorder. Here are some things to look out for there. Feelings of fear or dread that you just can't seem to shake. Constant thoughts of worry that you can't get out of your mind. Nervousness or jitteriness. Avoidance behaviors, even avoiding your medical care. Not going to your doctor's appointment, not checking how your blood sugar or blood pressure is. Repetitive behaviors that can be excessive, such as an obsessive compulsive disorder or OCD. Social withdrawal, pulling back from life. There are also specific anxiety conditions related to diabetes. There's fear of hypoglycemia or low blood sugar, or significant fear of injections or needle pricks or infusions. If you're having these signs and symptoms, it's important to get assessed to find out if you might have major depression or an anxiety disorder. Start by telling any member of your healthcare team that you're experiencing these emotions or thoughts. The providers in you will come up with a plan. It may include behavioral therapies that work, such as cognitive behavioral therapy, or CBT as we call it. They may also talk with you about medications that can help and that are indicated depending on a diagnosis. As humans, our physical health and our emotional health are beautifully intertwined. That's what makes us whole. In diabetes, the emotional health and the physical health are also intertwined. Having diabetes impacts your psychosocial health, and your psychosocial health impacts your diabetes, your heart health, and your disease outcomes. Keep paying attention to how you're doing, both physically and emotionally. Taking care of your emotional health is taking care of your diabetes and heart health. Thank you.